Picture this. Your monthly health insurance premium skyrocketing by 30% or more out of nowhere. It's not just a nightmare. It's becoming a harsh reality for countless families across America. But here's where it gets really personal. 8 everyday Americans are stepping forward to reveal just how deeply these rising costs are cutting into their wallets. As we delve into the heart of the Affordable Care Act, ACA turmoil, fueled by the longest government shutdown in US history, you'll discover why this isn't just about numbers. It's about the everyday struggles of people grappling with healthcare access and affordability. And this is the part most people miss. The ripple effects could reshape how we view government support in healthcare for years to come. Americans are now confronting the stark reality of escalating health insurance expenses, directly tied to the historic government shutdown that has dragged on. As detailed in this Washington Post analysis, linking it to GOP election fallout and midterm implications. Since open enrollment kicked off on November 1st, individuals have been able to purchase health plans for 2026 through Healthcare.gov and state-based marketplaces established under the ACA. Unfortunately, the news is overwhelmingly grim. Nearly everyone is facing higher costs, with some premiums jumping significantly, as reported in a separate Washington Post piece noting up to a 30% increase. This surge is driven by broader trends of inflating health insurance prices, compounded by the expiration of enhanced subsidies that Congress authorized about 5 years ago. To make this more tangible, let's break it down for beginners. Health insurance premiums are the monthly fees you pay to keep your coverage active. The ACA, also known as Obamacare, aimed to make healthcare more accessible by providing marketplaces where you can shop for plans with government help. Subsidies act like financial cushions, reducing what you owe based on your income. Think of them as a tax credit that lowers your premium bill each month. These enhanced subsidies were a temporary boost during economic recovery efforts, but they're phasing out, leaving many to shoulder the full burden. For instance, consider a single parent in a mid-income bracket who previously saved hundreds per month due to subsidies. Now, they might see their premium double, forcing tough choices between healthcare and other essentials like groceries or rent. The 8 Americans highlighted here illustrate the human side of these statistics. Take Maria, a teacher from Texas, whose family plan premium is rising from $500 to over $700 monthly. She worries it could mean skipping preventive checkups for her kids. Then there's John, a small business owner in Florida, facing a 25% hike that threatens his employees' coverage. He's contemplating cutting benefits to keep his shop afloat. Sarah, a retiree in California, shares how her subsidy reduction has added $200 to her bill, pushing her to rely more on Medicare despite gaps in coverage. Alex, a young professional in New York, explains the emotional toll of a 35% increase, fearing it will deter him from seeking mental health support. Emily, a single mum in Ohio, details how this means choosing between her medication and her children's school supplies. Robert, a veteran in Virginia, notes the irony of subsidies ending just as medical costs inflate, leaving him to dip into savings. Lisa, a freelance artist in Colorado, talks about the creativity it stifles in her work due to financial stress. Finally, David, a farmer in Iowa, laments how higher premiums could jeopardize his access to rural healthcare specialists. These stories aren't outliers. They're windows into why premiums are climbing, from hospital price gouging to pharmaceutical markups, and how the subsidy cutoff amplifies the pain. But here's where it gets controversial. Were those enhanced subsidies a fair lifeline, or did they mask deeper issues in the healthcare system, like why insurance companies charge so much in the first place? Critics argue that subsidies propped up an unsustainable model, rewarding profits over patient care. While supporters say ending them now, amid a shutdown, feels like punishing the vulnerable for political gridlock. This is the part most people miss. The shutdown itself delayed funding and negotiations, potentially exacerbating the premium hikes by limiting oversight on insurance rates. Is this a wake-up call for reforming how we fund healthcare? Or just another example of government inefficiency? What do you think? Should subsidies be restored permanently, or is it time to overhaul the ACA entirely to curb these costs at their source? If you've been affected by these changes, share your thoughts in the comments below. Do you agree that the subsidy phase-out is unjust timing, or disagree that it highlights needed reforms? Let's discuss. Your perspective could spark the next big conversation on healthcare equity.